Coming up on Your Life Redefined, a special in-depth look at diabetes and how this disease impacts the foundation of a healthy lifestyle, our feet.
Diabetics lose the gift of pain. They can't feel something, that there's a problem, so they continue on with the activity, whether it's a blister or a callus or a puncture wound. They don't think that there's a problem because the pain signal is not coming up to their brain to tell them to stop doing that activity. Take a look at your foot, pull your shoe off, pull your sock off.
Also,
well, we're going to get our dose of omega-3s.
Absolutely.
Beautiful salmon dish. Can you walk us through it, Jeremy?
Absolutely.
That'd be great.
Yeah.
we're whipping up an omega-3 rich recipe that's good for your heart. And later, a special tail-end feature to help your furry friends play better and live longer. This is one doctor's appointment you won't want to miss. Hi, and welcome to Your Life Redefined. I'm Dr. Anna Marie. We're going to kick off today's show with a topic that's very near and dear to my heart. Being a podiatrist, I thought we'd take a look at a part of the body most people take for granted, our feet. Well, that's unless they hurt or if you're a diabetic. Foot sores or ulcers that won't heal is a major complication of diabetes. They get infected and in extreme cases require amputation. But with new approaches and fancy footwork, podiatrists have been very successful in healing these wounds. Let's check it out.
A significant problem with diabetics, ignoring their feet. Sometimes people actually have to lose a toe or have a serious event before they will really change and make a change in their lifestyle.
Dr. James McGuire is the director of the Wound Care Center at the Temple University School of Podiatric Medicine. The majority of the patients who walk into the center are folks who have diabetes and have lost their sense of feeling on the bottom of their feet.
If you can't feel any pain, you're going to just keep walking on the blister, and the blister gets deeper and deeper. You get a significant ulceration through the skin. Once your barrier to the outside world is broken, bacteria get in, and you end up with a serious infection, sometimes partial foot amputation or sometimes even limb loss.
That's why it's so important not to try and treat these sores on your own. Some of the newest treatment options include materials that encourage the patient's body to grow new tissue and heal these open wounds.
We do skin grafts, the latest prepared skin grafts that laboratories have made. There's a number of new products out, such as Dermagraft, Apigraft, a number of things that we use.
Now, the goal with wound healing, of course, is getting blood flow back to the area to help the wound heal. One of the tools that you use here at the Wound Care Center is a circulatory boot, FDA approved. Could you explain how it works to the viewers?
The circulator boot is an end-diastolic compression pump. By end-diastolic, it means that it goes off at a certain time in the heartbeat. It requires the patient be hooked up to a set of EKG leads,
Did you get the leads right here?
which are placed on the patient's chest and measures their heart rate. And it goes off when the heart's in its diastolic phase or filling phase.
As for prevention, it's important for diabetics to check the bottoms of their feet, between their toes, and wash their feet every day. Also, your shoes should be sized to your feet, and see a podiatrist for your foot care needs. Larry Beck now pays special attention to his feet. Years ago, his mother dealt with a never-ending battle of an open sore.
It's just something that you have no control over it, and you can't do anything for it other than to just comfort your parent. Wish that you could do something more.
If you admit to yourself that you have a disease, you can take care of it. If you deny the disease will eventually get you, because you'll do things that prevent you from helping yourself.
According to the CDC, about 70% of all people with diabetes have nerve damage, which often leads to a loss of feeling in the feet, so you may not feel a cut, blister, or sore. These seemingly simple injuries can develop into open wounds and infections. Plus, diabetes reduces blood flow to certain parts of your body, especially your legs, so injuries take longer to heal, if they heal at all.
Diabetics lose the gift of pain. They can't feel something, that there's a problem, so they continue on with the activity, whether it's a blister or a callus or a puncture wound. They don't think that there's a problem because the pain signal is not coming up to their brain to tell them to stop doing that activity. Take a look at your foot, pull your shoe off, pull your sock off, look at it.
This is something that should not be taken lightly because it doesn't take long for these infections to progress to the point where your foot may need to be amputated. Here are some things to keep in mind if you're a diabetic. Add a foot specialist to your healthcare team. Wear padded socks to protect your feet. Clinically tested socks like these have been shown to reduce pressure, friction, and moisture that can cause blisters and foot pain. They'll also protect your feet from the inside of your shoe. Wear properly fitted footwear and never go barefoot.
I've pulled out cat hairs, dog hairs, human hairs. I've taken out toothpicks, electronic wires, staples, and it's all in the house, and they had no idea it was there.
These simple preventative tips will keep you moving, and remember, the more you move and stay active, the easier it's going to be to take control of your diabetes. Now, when it comes to our feet, did you know they change as we age? One of the biggest foot problems by far in our country is a loss of fat pads, which are located underneath the balls and heels of the feet. It's perhaps the one part of the body we never want to lose fat.
Part of the process of aging is that you start losing your subcutaneous fat. And that's what the padding is made up of subcutaneous fat. And a lot of times in the ball of the foot, the fat pad will actually migrate up towards the end of the toes, or up to the toes, exposing the bones that are what we call the metatarsal phalangeal joints, or where the toe and the ball of the foot meet.
Losing these fat pads means there's minimal protection between the skin and bones of your foot, making it vulnerable to friction and pressures that makes it painful to walk or exercise, especially for those folks who have always been active. Fat pads get thinner and wear down with age, activity, and a lifetime of moving around on hard surfaces. Let's face it, if you have pain with each step you take, you're not going to want to walk or do any other activity that you've enjoyed, and that's keeping you fit and mobile. So what can you do if you've lost most of those fat pads on the balls and heels of your feet? First step, see a foot specialist. Remember, foot pain is never normal. Wear padded socks that are designed to protect your feet. For decades, they've been very popular in the sports world. Professional athletes know from experience that clinically tested socks provide foot protection where the demands are the highest. Sometimes it's a combination of things that really provides the greatest relief, so be sure to talk to your doctor about wearing supportive shoes that fit your foot, padded socks, and an orthotic or supportive insert. These are simple but effective ways to make you feel better, stay active, and live a more healthier lifestyle. For more healthy living tips, be sure to check out our show's website on rl.tv. We'll be right back. Coming up next on Your Life Redefined, can preventing diabetes complications be as simple as eating the right foods?
Saute them or?
We just, yes, saute them with a little bit of hazelnut oil. I like the hazelnut because of the butternut.
Since heart disease strikes people with diabetes twice as often as it does people without the illness, when we come back, we have a tasty omega-3 rich salmon recipe to help lower those artery-clogging LDL cholesterol and triglycerides.
Welcome back to Your Life. I'm your host, Dr. Anna Marie. Ready for this week's healthy recipe? Well, we're going to get our dose of omega-3s.
Absolutely.
Beautiful salmon dish. Can you
Thank
walk
you.
us through it, Jeremy?
Absolutely.
That'd be great.
Yeah. Underneath the first piece of salmon right here, we've got a steamed sticky rice, the same type you'd use if you're making sushi at home, or that they use in restaurants for sushi.
And is that available at the counter, the sticky rice?
Absolutely.
All right.
Sure. Specialty stores online, specialty stores in your neighborhood.
Great.
Definitely. Underneath the second piece, we've got a pear and squash salad. Now we've got a little bit of actual yellow squash and zucchini in there. And this is what's called a batonnet cut of butternut squash, which is a pretty hardy fall squash.
Okay.
This is a Bartlett pear, and this is an Asian pear. A lot of folks aren't familiar with the Asian pears, but they're available just about any upscale grocery anymore.
So you can combine all these ingredients together
Absolutely.
and just saute them, or?
We just, yes, saute them with a little bit of hazelnut oil. I like the hazelnut because of the butternut.
Nice flavor.
Yeah, exactly. With a little bit of togarashi spice and ground black pepper for that to play against the sweetness of both the squash and the pears. Then the salmon, you can see it's very dark, almost a brown
Right.
bronze.
It's kind of like you said, it's sort of blackened.
Yes, exactly. And what we did We took our 5-spice powder and just seasoned the one side very well. Actually rubbed it into the flesh of the salmon and then seared it on that side. Started on a high heat and then backed it off to a lower heat and just let it sear and crisp very slowly.
Okay.
And then just flipped it over just to finish it.
Great.
The fish.
And then you, of course, presentation is so key here
Thank you.
within your restaurant. I'm just wondering, is that your, what sauce is that you touched on?
This is our house-made teriyaki. We make that here. And I put just a little bit of...
But how about as homeowners? What, just basically teriyaki over the counter?
Well, teriyaki over the counter typically is much thinner, like soy you'd buy over the counter. This is made, we actually use some sugar beets in the process to thicken
So you're
it.
telling me you made a recipe for us that we can't do at home?
Well,
No.
actually, we'll include that with this piece.
Okay.
And it's not hard. It just takes a little more time. To procure the sugar beets, you may even actually have to contact a specialty produce vendor in your area.
Any
I'm sure
substitutes that we can
outside.
make at home, though?
At home, actually, take some hoisin sauce that we get over the counter and thin that, warm it up. Don't bring it to a boil, and thin it with a little orange juice.
Very good.
And you'll get a very similar texture, very similar flavor.
What a great way to get that dose of omega-3s. Now, if you're interested in more healthy recipes, be sure to check out our show's website, rl.tv. We have a special Healthy Home segment today designed for you pet owners out there, especially for you folks that have been shocked to come home and see the damage your pet has done to the house. On a serious note, our pets can be in great danger from medications, household chemicals, and even home decor items. Our Dr. Jim Humphries has some simple tips when it comes to pet-proofing your home.
We think of our homes as places of safety and security, and we know about the obvious dangers like antifreeze and rat poisoning. But there are lesser known compounds and other household things that may cause a risk for our pets and our children. We tend to look at our homes and see areas of comfort and safety, but it sometimes helps to get down and see potential dangers through the eyes of our pets. The primary way pets get into trouble in your home is the kitchen garbage can. The smell's often a mask, hiding pieces of glass, metal, bone shards, and the like. An exploring pet could swallow these things and cause medical problems. Keeping your garbage in a secure can or behind a locked or childproof door is the best way of defeating the trash bandit. Other kitchen dangers include cleaning chemicals and insecticides kept in kitchen cabinets. To restrict pets' access to a particular room of your house, you can use a baby gate. Even well-meaning human guests might cause problems too. Unable to resist the puppy's eyes, food is offered again and again, often leading to digestive problems. Fatty foods, cooked bones, and chocolates should never be given. Even those supposedly healthy grapes and raisins have been blamed for kidney failure in dogs. Most people wouldn't intentionally give their medication to their pet, but dropped pills and tablets are often too tempting for our pet friends. Just one Tylenol can kill a cat. So be sure to keep all medications in a safe, secure location. Finally, take care in how chemicals and other garage items are stored. Gasoline, oil, antifreeze, and fertilizers can also have fatal consequences. There are 230 household plants and 15 types of foods that can be harmful to pets. Anything from cigarette butts to old discarded batteries can be dangerous. If it can hurt your child, it can probably hurt your pet. For Your Life, I'm Dr. Jim Humphries reporting.
Thanks, Dr. Jim. A lot of great information, especially the tip about getting down and trying to get your pet's perspective to see what they're going to be tempted to get into. We'll be right back.
When we come back, we're in the gym with our fitness expert with today's functional fitness tip. We're building a home gym on a budget. Stay tuned. Your Life Redefined will be right back. It's now time for today's trivia question. The majority of lower limb amputations performed in the United States are due to foot complications caused by diabetes. True or false? The answer when we come back. Did you figure out today's trivia question? Well, the answer is true. More than 60% of non-traumatic lower limb amputations occur in people with diabetes, according to the American Diabetes Association. Additionally, foot wounds, ulcers, and infections are the most common reason for hospitalization of people with diabetes.
Welcome back to Your Life. I'm your host, Dr. Anna Marie. It's now time for our weekly workout with Kevin Makeley.
Hey.
Kevin, how you doing?
I'm doing all right. How are you?
Pretty good. I want to build a home gym for $100 or less. Is it
All right.
possible?
It is definitely possible. We're standing around about $100 worth of equipment right here.
Let's start off with the mats.
The
Not
mats.
necessary, but it's a nice little perk.
Yeah, I think it's necessary. It's just good, you know, it's a little cushion, makes it a little more stable for you. So good idea, 10, 15 bucks, done deal.
Abs, stretching, yoga.
Standing, exercises, anything you want to do on the mat. Makes it feel more gymmy as well.
And a lot of people, this is popular, the Resistable.
Resistable, it's one of my favorite pieces of equipment in the home gym. So versatile, but it's great for abs. So have a seat, let me show
I
you.
actually
how
have
to
one of
do it.
these in my office, and I sit there and I write and I do, besides
right.
bouncing, I
You
do
you
stomach
hop
crunches.
around.
But it's great for stomach crunches.
Well, then let's see your technique.
Okay.
All right, perfect. Now I want you to actually roll down this way a little bit, and I want you to drop your hips, unroll on the ball, your hips and your back as
Like
well.
that?
And then crunch it all together using your abs to pull towards the middle. Perfect.
Ooh.
There you go. See, it's a workout just staying on the ball. That
Exactly.
works your core stability, that's why I like it, but it also increases your range of motion.
Great. And then you said you want to add some weights to this?
Sure. You want to do that? Look at you, you're all over it.
Well, this is a nice little, add, like you said, the core stability.
Right, so you can do more than just abs on
Right.
this. So slide down a little bit so your back is a little bit more supported. Yeah, just do a bench press.
And the weight's about,
These dumbbells, they're a little fancier than, you know, what you can get out there. These are probably about $20, $30 for the pair, but you can get, you know, less expensive ones for $10, $15 a pair.
sounds great. Now you have a resistor band here, which
Yes,
if you don't
now
want to
this.
invest in the weights, you go this
You
route,
can get the
correct?
same workout, and what's great about these is they're super inexpensive. I mean, this is like $10 for this. You can get like three of them for
Throw
like
one in your
15,
suitcase when
$20.
you go on vacation.
You can bring it to the office, leave it in your desk, whatever. It's a great tool.
It's the
So
same
we're gonna
idea.
do curls, chest up, shoulders back, abs side.
Good
That's it.
posture.
And we're gonna do the same exercise.
The timing there. Great.
Can we get that timing down?
Sounds good.
So I love this. This is just a great tool to have.
Very good.
All right. Next, the medicine ball. You ready for this?
Oh, that's about like 15 pounds, right?
Give or take. Yeah, it's about 15 pounds.
And
And,
that-
about $15, $20.
Another way to add resistance.
Yes, so you could do a squat without it, but I like to use it because it's not that much more weight, but it adds so much more to your workout. Perfect. Chest up, right?
Knees not above, not ahead of
Knees
the...
not in front of your feet, right? Perfect, in front of your toes. Excellent, now let's add, that's it. Look, you're one step ahead of me. That's what I like about that is you're just being creative. Just
Right.
adding another, little thing. You can do that, you can come down and reach out, and then bring it in, and then up.
Great.
You know, you can twist this way, that way. You can step on the stepper with the medicine ball. Adds
Okay.
about 15 pounds to your body weight, so you're increasing your resistance.
And the stair step adds about 45, 50 bucks to our
Give or
gym.
take, yeah, depending on where you get in and what brand.
And if you have a staircase at home, you can just do it on the stairs if you want, right?
Just be careful.
Right. And you can do lunges. There you go. $100 or less.
Many of us think of our feline friends as independent, self-sufficient, and rarely need any sort of medical care. When we come back, veterinarians are sounding the alarm over a significant increase in the number of diabetic cats being seen at veterinary hospitals across our country. Your Life Redefined will be right back.
Welcome back to Your Life Redefined. I'm Dr. Anna Marie. You know, almost everyone knows a friend or an acquaintance who has high blood sugar levels. Matter of fact, the Centers for Disease Control says diabetes affects more than 26 million people in our country. Sadly, as our four-legged companions mirror what's happening to us, some pets, especially our cats, are at a high risk for this disease.
Diabetes is a group of diseases that result from either inadequate insulin production or the inability of cells to respond to this hormone. Insulin is needed to help move glucose from the bloodstream into tissue cells to be used as energy. In humans, type 1 or insulin-dependent diabetes results from the body's immune system destroying the cells that make insulin. This is the common form of diabetes in our canine friends, and there's no way to prevent it. Type 2 or non-insulin dependent diabetes accounts for 90 to 95% of diabetes in people and 85 to 90% of cases in cats. In this case, the pancreas becomes exhausted or it fails to respond to signals to produce insulin. The important thing to remember is that it is possible for treatment to lead to a remission of the disease. While the number of cases of diabetes in dogs have remained static for many years, some veterinarians say they're seeing an increasing number of diabetic cats. Cats in our country have developed a tendency towards obesity. Being overweight is a risk factor for type 2 diabetes. Cats with diabetes often go extended periods of time with no real signs that anything is wrong. When signs do appear, you may notice your cat using the litter box more frequently or drinking more water. Cat owners are not always aware of these signs, especially if your kitty often goes outdoors. Without diagnosis and treatment, diabetes will eventually cause a condition known as ketoacidosis. This leads to dangerous changes in the blood chemistry, dehydration, and eventually death. When cats are seen by a veterinarian, a simple blood test can diagnose diabetes. Although your feline friend may need insulin initially, you might be able to reduce or even eliminate this medication as you help your cat lose weight. It's that simple.
There's new evidence that high-protein, low-carb diets are instrumental in helping cats defeat diabetes. Check with your vet. You know, many pet owners have a dog that scratches constantly. It's painful and frustrating to watch. After trying shampoos, other general treatments, and even changing the diet, the diagnosis tends to lead to an allergy. Our very own Dr. Jim Humphries takes a close look at this topic.
Skin inflammation causes an allergy from something your dog breathes in, and that is known as atopy or atopy. Like hay fever in people, atopy is caused by pollens and dust mites or even grasses and trees. Veterinarians know that pets of many different breeds and ages can develop this condition. Unlike people though, most pets don't sneeze or sniffle, but they do scratch because they are very itchy. So if your veterinarian can't find fleas and allergies to certain foods are ruled out, your pet may be suffering from atopy. Veterinary dermatologists recommend skin allergy testing as the gold standard for an accurate diagnosis. Unfortunately, there's not a cure for atopy, but you can do a lot to help keep your pets comfortable and less itchy. First, routine bathing is always helpful to reduce the number of allergen particles. A cool water bath in the summer is not only refreshing for the pet, but also cuts down the itchiness. Next, providing omega-3 and omega-6 fatty acids help the skin heal faster. When pollen counts are high, using an antihistamine can keep your pets comfortable, but you do have to try several types, and they only work in about half of all allergic dogs. Some pet owners want strong prescription medications like steroids. Well, now these drugs will make the pet feel better temporarily, but they only mask symptoms and are associated with some side effects during long-term use. Other pet owners are now turning to desensitization. By injecting a small amount of the problem allergen, pets eventually develop the proper immune response. They itch less, and that decreases the stress and allows them and their owners to get a good night's rest.
It's important to realize that you're not alone when dealing with itchy pets. It's very common. Your veterinarian can help you find the right plan that will provide your pet relief. Well, it's hard to believe our half hour is up. Until next time, remember, it's your life, live it, and live it well. Hope to see you next time.
For more information about Your Life Redefined, visit our website at rl.tv.
Do you feel vibration here? Good. Now, what I'm looking for is pinprick sensation. Do you feel sharpness here?
Yes.
Okay. Do you feel sharpness right here?
Yes.
Okay. And then you've got this area right here that's calloused, and that's right over that spur right there.